Hi, my name is Mandy Lee with Blue Ridge Behavioral Healthcare. I am the director of the Roanoke Valley Crisis Intervention Team and Marcus Alert System here in the Valley. We've recently started a co-response team along with all of the law enforcement jurisdictions throughout the Valley in response to something called the Marcus Alert legislation. So what this means is that in addition to law enforcement responding to calls, if an individual is in a mental health crisis, now we have the option to also send a therapist along to those calls. So it's providing a behavioral health response to a behavioral health crisis, meeting people where they are in the community in some of their worst moments of their life, and being able to provide that connection to services and resources and really hook them up with what they need in that moment. Whenever somebody calls into crisis, when they call 911 and or a loved one is in crisis, they can ask for a behavioral health response to this, in addition to law enforcement and EMS and fire, whatever is necessary for their level of crisis, we can provide that now. So it's an awesome service. In addition to that, if they call in, the dispatches, the public safety answering points, the PSAPs, are able to transfer callers who meet a certain level of need over to our partners at 988, which is the National Suicide Hotline, was rebranded over to 988 last summer. If an individual doesn't need an in-person response and really just could benefit from having a therapist or a counselor to talk to, dispatch is now able to hand that phone call off to our partners at 988 and let those clinicians take over, and we would never have to dispatch law enforcement to some of those behavioral health crises, which is even better for the individual who's in need of services.